As usual, Robert F. Kennedy Jr. is talking out of both sides of his mouth. He's working to undermine the health of Native Americans and Alaskan Natives, all the while claiming that he's committed to improving their health. Welcome to STEM Now. I'm Laura DiDio, reporting the commentary prepared by Crystal, STEM Now's anthropologist, STEM education researcher, and political activist. As an anthropologist, Crystal uses the term indigenous to refer to peoples who lived on the land from the earliest time or before the arrival of European colonists. Like the National Institutes of Health, Food and Drug Administration, Centers for Disease Control and Prevention, the Indian Health Service is the responsibility of Robert F. Kennedy Jr. in his capacity as Secretary of Health and Human Services. The Indian Health Service was established back in 1955 to fulfill the U.S. government's treaty obligations to provide comprehensive health care to federally recognized tribes. These treaties were signed in the 18th and 19th centuries. In these treaties, the indigenous peoples and nations ceded some tribal lands in exchange for benefits, including medical services. Native American and Alaskan Native peoples have a unique status in that they can both be U.S. citizens and citizens of their own indigenous nations. Thus, rather than being racial or ethnic minorities, they are classified as political minorities. Because of their treaties, the U.S. government considers them wards. The Supreme Court designates them as citizens of domestic dependent nations. Today, the Indian Health Service provides health care to approximately 1.8 million enrolled members of the more than 557 Native American and Alaskan Native federally recognized tribes in 35 states. The Indian Health Service has built hospitals and clinics in these states, and they employ nurses, doctors, pharmacists, engineers, dentists, and other healthcare professionals. Nearly 71% of whom are Native Americans and Alaskan Natives. However, the Indian Health Services has been chronically underfunded and understaffed, given the size of the population that it serves. The Indian Health Service focuses on reducing infectious diseases like tuberculosis back in the 1950s and preventive care like lowering the number of maternal deaths, which persists to this day. Kennedy has undermined the Indian Health Service. He's fired employees from programs that promote the health of indigenous peoples, including the CDC's Healthy Tribes initiatives. He's also closed 5 regional offices of the Department of Health and Human Services that cover an estimated 80% of the nation's indigenous population. However, Kennedy did rescind the firing of 950 Indian Health Services employees. Kennedy has also used the Indian Health Service as a weapon to force out senior officials who previously held prominent roles during the COVID-19 pandemic in 2020 to 2022. He's reassigned them to Indian Health Service regional offices, even though they had no experience with the Indian health. This includes Dr. Christine Grady, the senior NIH bioethicist, who is also Dr. Anthony Fauci's wife. Kennedy eventually fired Dr. Grady after years of attacking her husband. On April 10th, Kennedy visited the Navajo Nation in Arizona. He talked about preventing chronic disease among Native American and Alaskan Natives, even after he cut funding to the CDC's Healthy Tribes initiative. Tribal leaders and health officials told the Associated Press that they considered these cuts, along with cuts to the Bureau of Indian Affairs and the Bureau of Indian Education Affairs, to be violations of the U.S. government treaty obligations. Indigenous activists and politicians are demanding that Kennedy and the Trump administration uphold these treaty obligations and consult with them rather than ignoring their needs by cutting critical programs and staff that serve their communities. So, what can you do? Identify the federally recognized and other tribes in your state. Offer to volunteer. Also, contact your elected Senate and House representatives to express your concern and outrage. In the video description below, we have links to the Senate and House committees on Indian Affairs. If any of your elected representatives, even if they are Republican, are on these committees, contact them and let them know that you are watching and care. Being a political activist is not easy, but let's go out there and be advocates on behalf of our communities and speak out against those who seek to do them harm. Thank you for watching. Please subscribe to this channel, like and comment on this video. Thank you.